Good afternoon, everyone. My name is Alex from Swoosh English, and welcome to the class today, which will be focusing on the OET Speaking, particularly on one of the criterion, which is appropriacy. So we'll be looking today at using appropriate language. I'll be going through some tips, and then also I'll be including some exercises that we can have a look at together in order to practice some of the tips that I will be talking about. So I'm hoping that there'll be lots of participation and as many people will be getting involved as possible. So let's have a quick look today to see who is in the class. Welcome to all of you. So we've got Ramesh, hello to you. I hope you're doing well. You have the privilege of joining this class. I have the privilege of leading this class. So fantastic to see you today. Also, I can see that we have here Amadip. Hello, Amadip. Hi to you. Rafia, good afternoon to you, Rafia. Jose, hello, Jose. Good afternoon as well. Akar and Joseph, Sunu as well. And good afternoon, Sana, Rebecca, Remy, Marie. And Venkatesh, Redmi, lots of people, Christine, hello to all of you. And it's fantastic to see you all in the class today. I hope that you find it useful, and I hope that you take the opportunity to get involved and to participate when we start looking at some of the exercises together. Also, hello to all of you who are watching this class on Facebook. It's great to see you here as well. So I can see we've got on Facebook, we've got Florette, Michael, Aki as well. So hello to all of you who are here on Facebook. And if you end up sharing this class, that's fantastic. Please do share it so that as many people as possible can watch it and can see it when it's released later on, once this class is finished. So wonderful to see so many of you here today. If you're ready to participate and you're ready to answer questions and to ask questions as well, please do let me know in the chat. And I can get as many people involved in this class as possible. So let me start then by beginning with the presentation that I'm going to be looking at today. And it is, as I said before, a presentation about appropriacy. So let me just share this with you now so that we can all have a look at this together. Okay, so here we are then, keeping it appropriate, how to score highly in appropriacy for OET speaking. So in this class, we're going to focus on the criterion of appropriacy in the OET. So just before I actually get into some of these tips here, when you hear the word appropriacy in relation to the OET, what do you think are some important aspects of using appropriate language? What would you give as your sort of top tip when it comes to using appropriate language in the OET? So if you could share your ideas in the chat, I'll have a look at them and share them. What for you is appropriacy and appropriate language? So it'd be good to get some of your ideas and some of your feedback. And then obviously I'll share some of my ideas with you as well. So let's have a look and see what you think. So I'm just gonna have a look now. Okay, so here we go. Some great suggestions here then. So Amardeep says empathetic language, very nice. Rebecca, it's got to be relevant. Yep, absolutely. Marie, English grammar appropriateness. So grammar is important. Grammar is a feature of accuracy. Not judging the patient, says Ahmed. Yep, definitely. That is a good point. Rafia, just bring up what Raf is saying here. Understanding the patient's condition. So yeah, again, I think that's the empathy side of things, isn't it? Understanding the patient's attitude. If you're talking about the patient's medical condition, then that would come into, I guess that would be important as well, because knowing the condition, knowing the background would mean that you would address the case appropriately. Ahmed, formal, good point. Yep, formality is absolutely important and appropriate. Right choice of word, says Fatima. Good. Ekmad says it's got to be clear. Yes, definitely. Great knowledge about the topic. Yeah, so you are expected to have obviously that background knowledge being medical professionals. So it is important, although you will obviously, of course, have details on the roll card for you as well to help you in terms of the sort of language that you should be using. So Nathan is talking about grammar. And Jose, talk according to the situation. Yeah, so what you're saying should be relevant to the situation. Absolutely. Tone is important. Yeah, using the right tone. So we're going to look at that in a bit more detail in the class. Sticking to the topic. Okay, yeah. So definitely not sort of including irrelevant information. That is important. Yeah, talking in a way and tone that's appropriate to the situation. Really good point there, Sana. So you may have a topic or you may have a condition in relation to a patient which you would communicate differently if the patient were, let's say, of a certain background, a certain age, or had certain experiences. You may communicate your information differently to one patient as compared to another patient. So definitely making sure what you say is relevant to the context of the actual interaction. And so knowing the patient's background is going to be relevant to that as well. Okay, Ratner saying semi-formal conversation, so not being too formal. Formality is important, but yeah, we will look at that as well because you're right there to sort of bring in other elements in terms of looking at levels of formality. Okay, quick look at Facebook here. Alessa is saying information relevant to the role play. Definitely. Florette, no medical terminology or academic words. Okay, so this is important because ultimately you're going to be talking to a patient. You're not going to be talking to another medical practitioner. So you've got to be really careful about the sort of terminology that you use. Okay. So let's have a look then. Some fantastic suggestions to start us off with. A lot of the things that you're saying are the sorts of things that I'm going to cover, and I'm just going to give some examples and some details in relation to what you said. So some really good suggestions to kick us off. So let's have a look then at some of the ideas which we've got here, and then afterwards, as I said, we're going to do some exercises together so that we can look at putting some of these ideas into practice in practical situations. So in terms of appropriacy then, a sort of a general introduction to appropriacy. The OET speaking is graded from two perspectives. So you're graded in terms of the language that you use, so things like, sorry, grammar, and obviously the vocabulary that you use, and also you're graded on communication. So the extent to which you are able to communicate successfully and appropriately with the patient or the carer. When it comes to language, speaking appropriately is something which is deemed of great importance in order to achieve a high score in the exam. But what is appropriate language, and how can we make sure that we're using it? So we're going to investigate these questions by looking at some key tips here on the criterion of appropriacy. So first of all then, a lot of you were saying, and it's a really good point. So putting this into practice, let's have a look at the description here of the caregiver on the roll card. Take a quick read of it, and I want you to tell me in the chat, what do you think? What language here do you think would be inappropriate to use in the context of this interaction? So have a quick read. What can you see here that should be adjusted? What can you see that would very likely be inappropriate to use when addressing the caregiver in this case? So I'm just going to give you a few moments to read this, and then I will check to see if there are any suggestions in relation to inappropriate language. Okay, so we're not criticizing the grammar here. We're having a look at anything in here that might be inappropriate. Okay. So what do we think? Okay, so some suggestions coming in already. Some good suggestions here. So Lois says, she talks about the acute meningoencephalitis. Okay, good. We're going to come back to that. Marie's making a point saying not judge the patient because they did not know there was a vaccine. Rather, it should be an educational discussion. Very good point. Absolutely. That's something that's important to bear in mind. Christine also goes for the acute meningoencephalitis. Amardeep says great opportunity to guide what the vaccine is and available for the second child. Okay, so great. So lots of ideas here then in terms of how this conversation could progress. Arkar talks about explaining the benefits of vaccination. Nimi provide education on vaccines. Joseph Youngbage for repetition of the same information. No, Joseph, no, it's just giving more information. So it's a young boy, but now specifically the age is 4. So remember here, we're focusing more on appropriacy, not so much criticizing grammar. Child's immunization discussion. Okay, good. Yeah, so lots of ideas coming up here. Just to address a question that's come up here, a question was asked, in terms of will we have a recorded lesson for revision later? Absolutely. I believe that this lesson will be released so that it can be reviewed afterwards. So watch this space. Just keep a lookout on the Swoosh Facebook page and on your accounts just to see that video later. So great. So we've got some fantastic suggestions here. Just have a quick look at Facebook as well. Just see some ideas coming up. Yep. So Alessa is saying it, acute meningoencephalitis as well. Absolutely avoid the medical term. So here we are. Absolutely. This is the phrase to avoid using, isn't it? The acute meningoencephalitis. And it's because of the reasons that you guys have been saying. So this phrase, acute meningoencephalitis, is not a phrase that the parent will likely be familiar with. So you might avoid using it. You should avoid using it. Instead, focus on the more familiar disease, which will not confuse the patient, which is mumps. So almost every patient or every caregiver is going to be aware of mumps. It's a very common disease. So using that is not going to provide any confusion for the patient, and they'll be able to follow you without getting distracted by the lack of understanding because of the technical terminology. So due to the patient's or the parent's lack of knowledge regarding the vaccine, you should be prepared to explain to him or her how the vaccine works and also why it's important. So that's what some of you were saying as well. So really well observed. If the parent, on the other hand, was familiar with vaccinations, let's imagine it was a different situation. The parent actually knew about the vaccinations. It would not be appropriate to go into such a basic explanation as to what the vaccinations are and how they would work, because that would be deemed as possibly talking down to the parent or even being patronizing, which would be seen as being inappropriate. So the content of your response must relate to the background and profile of the person with whom you are conversing. And obviously you picked up in this case that the parent didn't know about the vaccine, so absolutely explaining the vaccines and how they work would be an appropriate way of developing the interaction with this patient. So well done, some good responses there. Okay, so that's tip number 1, adjust your language to suit the patient. Tip number 2 relates to formality. So be friendly, but formal. So this again relates to some of the comments that were made right at the beginning of the class here today, is that we do want to be formal, but we want to be approachable. So it's important to show empathy as a medical practitioner, as I'm sure we're all aware, and to be friendly and approachable in relation to your parents. However, appropriacy demands that you use language which shows your professional demeanor. So it's a good idea to be friendly but formal in your role plays. Examples of this would be saying something like good morning or good afternoon rather than hi, for example, when greeting your patient. It's friendly, but it's formal. Use indirect question forms and formal language, such as, would it be possible for you to reduce your alcohol intake, rather than direct question forms and informal language, such as, can you cut down on your alcohol? Okay, so cut down is an informal expression, phrasal verb, and also very direct. Can you cut down on your alcohol? It's better to use a more indirect structure, which is more formal. Would it be possible for you to reduce your alcohol intake? Be precise and clinical in your language. Inform the patient that his blood test results will be made available within 48 hours rather than in a couple of days. So wherever possible, it's great to use precision. The reason for this is because patients will have an expectation that their doctors and nurses are reliable and professional, so language should be used in order to show that. So the more precise you are, the more clinical you are, the more trust you will be able to engender within the patient or the caregiver. Okay, so that's tip number 2 then. Be friendly but formal. Tip number 3, prepare yourself to deliver bad news. So in a number of role plays, just as in a number of consultations in your real life experience, you'll have to deliver bad news to the patient. And how you do this is a key aspect of appropriacy. So one of the most difficult things, I would imagine, as well, is doing this as a healthcare professional, is actually having to deliver bad news. Let's say, for example, then, that a patient's results confirm cancer. It would not be appropriate to announce this without thinking about the impact this news will have on the patient. You need to express sorrow. You need to allow time for the patient to process the information and ask questions. And then you need to let the patient know his or her options. So you would break the information down. You wouldn't give the patient all of the information at once. You'd give them time to respond. You would give them time to react to what you're saying. Use your real life experiences to prepare you for this, showing empathy, being supportive, and staying calm as you would in a real life situation. On the other side of this, it's also important that if the patient gives you bad news, that you show empathy as well. So let's say, for example, that the patient tells you that their mother recently has experienced a serious illness. As a medical professional, you would want to respond to this. So you would give a response such as, "Oh, I'm sorry to hear that. Oh, that must be really difficult for you. I'm sorry." So constantly showing empathy to the patient, showing empathy when you deliver bad news, but also when you receive bad news from the patient as well. So that's tip number 3. So let's have a look now then at tip number 4. So as well as bad news, also as medical professionals, you are going to be at times, fortunately, delivering good news as well to the patient. So it's also important that you do this in an appropriate fashion. And what do I mean by this? Well, the contrast to the above will mean that you're going to show a very different reaction to providing good news as opposed to bad news. So you want to make it clear to the patient that something positive has happened. Think about how you're going to make the patient aware of the fact that the information you're giving is positive, beyond just the words which convey the information itself. So a phrase such as, "We've had some positive news," would be a really good way to introduce something positive. Or, "I'm happy to say that the results have confirmed that your cancer is in remission." Okay, so just a little phrase. If you just said, "Your cancer is in remission," okay, it's great, it's positive news, but it might take the patient a little bit of time to process it as positive because of the way that you expressed it. So if you just make it really clear by using some kind of phrase, some kind of expression, so that the patient is fully aware of the situation, then that can be a really nice way of using appropriate language and showing empathy in a positive way. So again, "I'm happy to say that the results have confirmed your cancer is in remission," is much better than just saying, "Your cancer is in remission." Use a rising intonation to emphasize the positivity of the results. So, again, using intonation. So, "I'm happy to say that your cancer is in remission." Okay, you don't have to exaggerate it, but just use some kind of usually it's a rising intonation when you're expressing positivity about something. So that is tip number 4. And a final tip that I want to look at today is tip number 5. So be measured in your approach. So what do I mean by this when I talk about being measured? Well, sometimes your patients are going to ask you for questions, going to ask you for information which you cannot give a definitive answer to. For example, if a patient asks whether they will have to have hip surgery and you haven't yet conducted a scan on the affected area, in these cases, it's important to balance your response using phrases such as, "It's possible, but we require more information," or "That is one of the options available depending on further results." Or another option would be, "That's not something I can confirm right now, but it is a possibility. So using this sort of language keeps your options open and it avoids misleading the patient, which is something you don't want to do, as of course, misleading the patient would be very inappropriate. So those are some general tips then in relation to using appropriacy in the OET speaking. What I want to do now is just have a quick summary. So a summary of the points: adjust content and language to suit the addressee. So that's either obviously the patient or the caregiver. Be friendly but formal. Be approachable, but make sure you're professional. Give good and bad news appropriately. Think about how you could use intonation with this. Think about some expressions you could use to make it clear that the news you're giving is either bad news or good news. How can you soften bad news so that it makes the patient feel less distressed? And how can you emphasize good news to make the patient feel encouraged? And also make sure that you keep calm and measured. Stay precise in your information. Don't give the patient misleading information wherever possible. So some practice then. Here is an activity. So here are some notes from a roll card. I want you to look at these notes below, and I want you to decide what language might you avoid using when addressing the patient. So similar to when before we looked at acute meningoencephalitis, what sort of language would you avoid using in this case? How might you rephrase that language? And also, what sort of information do you think it will be appropriate to focus on during the interaction? So I'm just going to give you a minute or so to read the description below, and then I want you to share your ideas in the chat in relation to these questions. Okay, so have a look and let me know what you think. And obviously, I'll have a look at your responses both here in the chat and also on Facebook as well, on our Facebook group. Okay, just a quick point. I've just noticed there's a comment here from Tatsultan in relation to remission. So remission is a commonly understood term. So it is something that you would generally expect the patient to understand. In terms of a layman's term for remission, I think it is a commonly enough understood term that you wouldn't need to use another term for remission. Yeah, it is a commonly understood term. Okay, so some responses coming then in relation to this practice activity. Keep your responses coming. I'll be reading them out in just a moment. Let's see. Okay. Okay then, so let's have a look then at some of the suggestions here. So yeah, we've identified the medical jargon here, the anterior myocardial infarction. So definitely we'd want to avoid that. So what could we use instead of the myocardial infarction or the MI? What sort of terminology could we use that would be more familiar to the patient? So let's see what we've got here. So Sana is saying that, so don't use the medical terminology, give information about the positive effects of some weight loss, good diet, and mild to moderate exercise, helping in long-term recovery. Yep, very nice. Definitely, that would all be appropriate, wouldn't it? In order to, because you want to focus on the recovery, the patient is worried about that. So absolutely, you'd want to give that sort of advice. Nonye, heart attack. Yeah, absolutely. So that is the layman's term, isn't it, for a myocardial infarction is a heart attack. That would be something that he'd be much more familiar with, or she, and so we could use this language in order to avoid confusing the patient. Very nice. Okay. Good, and Narayan as well has also identified that the layman's term would be heart attack. Great. Okay. So Sanna's also saying we could talk about taking medication on time. And Chris, it's important about providing information. It's important to focus on providing information and reassurance. Absolutely. Okay. Okay, great. So lots of great suggestions here then. So another activity we're going to have a look at. So this is related to the same task, but this now is the first task in relation to the previous notes. So have a quick look at what the first task is. And also, I want you to share your ideas in terms of how you could use formal but friendly language in order to approach this task. Okay? So formal but friendly language in order to deal with this task here. It's a number of possibilities, so let's see what ideas you come up with. Okay. So some ideas being shared already. So let's see. You seem anxious. What's bothering you? Okay, Nimi. So maybe a little too direct in this case. Maybe a little informal. Like, you know, what's bothering you? So I think we want to be a bit more formal than that in this case. So we want to be friendly, but again, we want to maintain formality. Okay, so Abidemi is saying, good morning. Can you share with me your concerns? That would be a nice way to approach it, definitely. Good afternoon. I am Dr. Sana, and I've been told that you have some concerns regarding your recovery. Please tell me what's on your mind. Yep, that's nice. It's friendly, but it's formal. Good. It must be hard for you, but Maya, know what exactly is bothering you. Yeah, so we're showing a bit of empathy here as well. Would you be able to tell me about your concerns? Good, yeah. So yeah, using that modal verb, would you be able to, is a little bit more formal, isn't it? Do you have any other concerns about your recent heart attack? Yeah, the only thing I would say here though, be a little bit sensitive about using sort of heart attack, because just even using the expression itself can sometimes be a bit stressful to hear. So if the patient talks about it, said, you know, my heart attack, then of course, you know, happily mention it, but just be a little bit sensitive about it. Maybe don't mention it right at the beginning. So this is what we call sort of using euphemistic language. Euphemistic language would be basically, okay, yeah, referring to a condition, but not necessarily directly. So how have you recovered from your recent health situation? How are you feeling at the moment? Are you feeling more stable? How has the process of recovery been going so far? So those sorts of things. But yeah, some really good suggestions as well from from you guys as well, and you've shared your ideas here. So just on Facebook as well. So what's your concerns? But of course, just make sure we're using accurate grammar. So, and again, maybe as well, just a little less direct. So do you have any concerns that you would like to share with me? So something like this, just a little bit less direct, so it sounds a bit more formal. Yeah, Maya's saying, so it seems that you're worried. Could you tell me more about the situation? Something like this is more appropriate. So good, lots of good suggestions here then. So a final task that we're going to look at today with a bit of practice. So I want you to have a look at the following utterances. Do they express good or bad news? And how could they be altered to make them more appropriate? Okay, so I'm just going to give you, again, another minute to have a look at this. Is it good news or is it bad news? And how could you make them more appropriate? So I'm going to give you a little bit of time to share your ideas in the chat, and then we'll see what you come up with. Okay, so let's see if we've got any suggestions coming in so far. Let's have a quick look here. Okay, so we've got some good expressions here. With the first one, it is bad news, is what's being recognized here, but there's treatment available. So very nice. So that's, that can be included, can't it? So I do have to tell you, unfortunately, that your child has jaundice, but we do have treatment available. So yeah, absolutely. Yeah, Amber, it's a nice one. I'm sorry to say that your son has jaundice, but yeah, and then talking about the available treatment would be a very nice way to make this more appropriate. So obviously, as it is currently, it's too direct, and there isn't any sort of discourse marker to express whether this is good news or bad news. So you're not helping the patient process the information, but certainly saying, I'm sorry to say, or I'm afraid that your child has jaundice, definitely helps the patient to process that information better. And talking about treatment would be a really nice way to soften that bad news as well. For B, anyone? So complications. Okay, so I've not seen any suggestions for B just yet. Another one with jaundice, yep, saying that it's very common as well among young children, among infants. That's another important point to make as well. Yeah, just to sort of help to put the patient a bit more at ease. So Maria is talking about D. So this is good news, definitely. But what could we do to really let the patient know that it's good news? So this is at the moment, it's very matter of fact, isn't it? A statement, you've recovered well after your heart attack. Okay, but can you not add some kind of phrase, some kind of indication which helps the patient really recognize that this is good news? So we'll come back to that. Arkar relating to B, I'm really sorry to inform that she has had some complications after surgery. Yeah, so just again, showing that empathy for the parent in this case. I'm really sorry to say that there have been some complications following surgery, and and then obviously you want to sort of get on to what can be done to try and improve the situation. But yeah, definitely using some kind of phrase such as this is really important. Good. Okay, and for C, Lois is saying, good news, I'm happy to inform you that you have been discharged, or in this case, it's the son. So I'm happy to inform you that your son is ready to go home. One of the most important things for any parent is for their young children to be able to be safe at home with them. And so, yeah, saying that, your son now is able to go home, it would be a really nice way of expressing this. So let's have a quick look at the Facebook group and see what's being said here. Yeah, so really, I'm sorry to inform about the complication your child is undergoing after surgery. Again, yeah, just expressing some sort of empathy in this case is important. A and B is bad, C and D are good news, absolutely. And we've also looked at some ways that we can express this good news and bad news appropriately. Okay, then. So some really good suggestions, some really nice ideas. Here are some sort of possible answers. A lot of it is what we've already said together, so we don't have to spend too much time on this. But yeah, we looked at A and we acknowledged the language which was not appropriate. For B also, we had a good discussion in terms of some of the appropriate language we could use to address the different points. And for C as well, here are some ways that we could express the bad news and the good news for the scenarios that were related in exercise 3. Okay. So those are some suggestions, but the examples that you came up with as well in the group were also very much appropriate. So that's taken us to the end of today's class. Thank you very much for your participation. Just before I do end the class, I do just want to let you know about a promotional offer that we currently have available. So I'm just going to provide some information on that right now and bring that up. There are some OET packages that we do have available. So let me just share that with you now. I'm just going to bring this up here. Okay, so as you should be able to see on the screen now, we have a number of different packages catering for different needs. So I could see just in the Facebook chat here that we've got some people, so Rashid, you're asking about sort of information and sort of packages that we've got. So here are the ones that we're offering. So they start from as low as $49 in terms of the sorts of support that we can provide. And you can see that there are different packages with different levels of intensity and different sort of exposure in terms of sort of teachers such as myself who can provide support and really guide you as much as possible towards getting that pass grade and above when it comes to the OET exam. So just sign up at www.swooshenglish.com if you would like to take one of these packages with us, and we would be extremely happy to have you on board and working with us to achieve your goals. So the information is all there on the screen. So it's just left for me then to say thank you very much for attending the class today, to all of you who attended in the Zoom link and to all of you who are watching live on Facebook. It's great that you're involved. You're always really interactive, and that makes the classes so much more rewarding and so much more useful when you participate the way that you do. So thank you for getting involved, and thank you for attending, and I will see you all very soon. So take care. Thank you very much.